So where we left off last week was, or last lecture was with PTSD. We talked about a lot of anxiety disorders and how those progress into further illnesses and further afflictions that people might experience, right? Over time, our bodies are designed to handle stress at a very short term, maybe a couple hours or a couple days, or maybe even a couple weeks. But anything beyond that, and it starts wearing on our system. Our norepinephrine is constantly on guard, and we're always maintaining this alertness. We've got all the energy is taken away from our immune system, so our immune system begins to fail us. We might not be sleeping as well. So that makes us lethargic and irritable throughout the day. So anyway, all these things start to wear on us for a while until something happens, this phenomena that happens where we're just constantly on guard, sinks into this idea of helplessness and hopelessness, where we just feel like no matter what I do, I just can't fix this, right? And that's where we start to see mood being affected, right? We see that with anxiety. Somebody that has high anxiety, what do they look like? When you talk to them and you interact with them, how do they seem?
On edge and just like not themselves.
Yeah.
Like severe anxiety, they may be like fidgeting or tapping their leg or something.
Right. Yeah, absolutely. Yeah. You see them on edge, like they're just ready to, break out and do something. Right. So after a while, like I said, that, able to continue that level of activity, but at a certain point, it starts to wear on them and impact them negatively. So, so with mood disorders, I'll share my screen with you here. So with mood disorders, most people have an occasional mood swing, but the disorder really involves a significant, keyword here, significant and persistent disruptions in mood or emotions that cause impaired cognitive, behavioral, and physical functioning. Okay. Now, when we say cycles of mood disorders, we have usually, like, the normal track of depression is somebody experiences that helplessness and hopelessness, and they just kind of stay isolated, unenergized, and lack of interest. They start developing a lack of interest in things that they used to be interested in, and they start to kind of pull away from things and people that they enjoyed hanging out with. So with mood disorders, we can sometimes see what's called bipolar. So bipolar, meaning two opposite poles. Either we're really, really happy and energetic, or we're really, really depressed and in the dumps. Okay, so manic mania is described as this period of unexplained, just like this can't sleep, just on the go constantly, have this flood and flight of ideas. Our ideas of ourselves and our ideas of our situation is super inflated to the point that it's almost unrealistic, or it is unrealistic, right? So that's what we see during mania. And then, of course, what we see in depression, as I have on the slide, is this coming to reality, this realization that I have spent all my money, or I have ruined all my relationships, or I've lost my house, or I've lost my kids, or something. And then we see them sink into this deep, deep depression. So as you can see in the middle here, 0 is about level, right? And normally we expect people to see, let's see if this shows on here. It doesn't. Okay. We expect people to see about, a little, maybe a 1 to -1, throughout their month or throughout their year. Sometimes we're going to be up on life. Sometimes we're going to be a little bit down, but we shouldn't see it really vacillate too far in either direction. And when it does, that might indicate that there are greater forces at work. There might be a chemical imbalance. There might be, lack of vitamin D or something. Something is going on that would not explain that unless it's event driven, right? So, for example, many of us have lost a friend or a loved one, right? So that would be an example where we just might get pretty low. Some of us maybe most definitely a -1, maybe a -2, maybe even a -3, right? On this chart. So, but for the most part, we would be able to bounce back to about normal, or maybe even a little above normal as time goes on. So, but with bipolar disorder, it doesn't happen that way. We see a chemical reaction, a chemical imbalance in them that gives them that extra boost of energy. And right about where you see about a +1 or +2, that's where we see things really take off with that individual, where they get very destructive as far as their lives. They don't regard paying their bills on time, or going to work on time, or maybe they're out partying or something like that. And when they get to that manic point, again, we'll see them drop. So this happens over and over and over. It's a cycle. It's very cyclical, and it could go anywhere from a couple days to a couple months. One of my clients had this cycle that she went every 2 years. And how it usually occurred is she would get manic. She would spend all night partying and disregarding the safety of her kids and her family. And this would last for probably about a month or two until she moved out, lived with somebody younger for a little bit, abandoned her family, and then came back to this realization that she needed to get back to good. So mended things with her family. Luckily, she had a very understanding family that helped her through this, but got on medication, and then stayed on medication for about a year and a half, and then went off of it, and then repeated this cycle every 2 years. So the key to this, and I'm going to kind of throw treatment into this, is usually staying in therapy with somebody, with somebody you trust consistently, and also having that person maintain their medication regimen and having it constantly monitored. Because if there are any changes, like if they start getting manic, we may want to induce some kind of depressants or something to bring them back, as opposed to, or antipsychotics, I think is what we call them, in order to bring them back to levels so they don't rise up to that point and affect their lives. Okay. So major depression looks a little bit different. Okay. So as opposed to bipolar, major depression, I already talked about, we might see it's an event driven. Sometimes it's not. It can also be, it could also be a chemical imbalance as well, where somebody just has something wrong internally that drops their energy and drops their mood, and they feel helpless and hopeless. And then with medication, or maybe just even naturally, they can build back up to about level. And sometimes they even get above level. But for the most part, those super lows are things that we want to watch out for, because those are usually the sign of like suicidal ideation and suicidal gestures, even sometimes. Okay. And of course, that's our ultimate negative outcome that we don't want to happen, is somebody completing suicide. That's what we hope to avoid. So major depressive disorder, MDD, which is classified as, is characterized by extreme and persistent feelings of despondency, worthlessness, and hopelessness, combined with lethargy and lack of interest and enjoyment of most activities. Okay, so we usually see emotional symptoms like feelings of sadness, hopelessness, helplessness, guilt, emptiness, or worthlessness. We also will see feeling emotionally disconnected from other people. Like I said, they isolate from others as well, and turning away from other people, especially when they're trying to help. We just see this further isolation, and usually, I would say a lot of the cases that I see major depression, people put on a fake face to not tip their hand and let anybody know that they have something going on. Okay, so some behavioral symptoms that, according to the DSM, would show that they have a dejected facial expression, which means they look void of any emotion whatsoever. They make less eye contact, and they kind of look down all the time. They don't make eye contact because, why do you think that is? Why do you think they avoid eye contact? What is it about depression that you think people make eye contact or look downward a lot?
It could both involve kind of the isolation aspect of, not really interacting with people on that kind of attentive level of speaking and looking someone in the eye, and also, maybe feelings of like insecurity that may come from the worthlessness and hopelessness aspect of what they're experiencing, and just, feeling, not feeling like they can kind of put themselves out there, or feeling well enough to kind of interact with people in that way.
Yeah, absolutely. And that's, I think you said that very, very accurately. So thank you, Casey, for bringing that up. But it's almost a shame, right? Because we are very expressive people. We communicate maybe only 20% verbally. Everything else is in our body language. It's in our face. It's in our expression. But the words that come out, let me clarify, the words that come out are only 20%. It's how we use the words, or how we use our voices, or the volume of our voice, or the pitch of our voice makes up the other 80%, along with body language and facial expression. So one of the ways that we communicate with people when we feel equal to them is by making eye contact. If we don't feel equal to that person, or we feel less than, then we tend to break eye contact. But a person with major depression, they smile less often. They're slowed in their movement, right? They might be tearful a lot and have just spontaneous episodes of crying. Again, we mentioned loss of interest in pleasurable things and activities, including sexual intercourse. People that are depressed tend to engage in sex less. Interestingly enough, a lot of people that are going through manic phases tend to have sex more. So and manic being that bipolar phase. So yeah, that I always thought was interesting, is even though we call it falls under the mood category for diagnosable conditions, there is a condition, there is a phase or a stage within that where somebody actually engages in higher than level sexual activity. And again, they're withdrawn from social activities, okay? In cognitive symptoms, we'll see difficulty in thinking and concentrating. And if you think about a time that you felt a little blue or felt down in the dumps, it was difficult to concentrate and remember things, right? I mean, forget about where you put your car keys. You probably put them down somewhere and didn't realize where they were. You see a lot of this mindlessness occurring, right? Global negativity and pessimism, meaning that the person just always thinks that something bad is going to happen, or that they're experiencing the worst case scenario, whatever. And then again, suicidal thoughts and preoccupation with death. We come armed. We have a self-defense mechanism that, and you can see it in our physical activities, that where we want to avoid pain, right? So what happens when you touch, at a young age, you touched a stove that was really hot? What happened in that moment?
Pull your hand away.
You pull your hand away. You learned instantly not to go near that stove when the red light was on, or if it was beeping or whatever. So we have this natural tendency to avoid things that are uncomfortable for us. And emotional pain is no different than that, especially when it comes to depression. If we are feeling helpless and hopeless, and whatever thought or event or person or situation it is that we're avoiding having to confront is so great, we just want to run away, right? And when we look at suicidal ideation, it's not the act of actually just wanting to kill oneself. We want to preserve ourselves, right? It's actually conflicting in how that works, because we want to preserve ourselves so much that all we can imagine is just not being here anymore. It's a really interesting dynamic. So people that have suicidal ideation, all they're really trying to do is avoid the pain and escape. They're engaged in escapism. So they might be a little bit more preoccupied with death, because that helps them think that maybe there's a way out. Maybe there's a way I can solve this and not experience that pain anymore. Okay, so physical symptoms Changes in appetite, and we can see that happen in one of two ways. We can see a loss in weight where somebody doesn't eat because they don't have the appetite, or we can see a significant gain in weight because somewhere maybe they feel rewarded for eating. That makes them feel good. So they will see a drop in energy and an increase in appetite, so therefore weight gain. Oftentimes we'll see both insomnia and oversleeping. So we'll see somebody that can't sleep because their mind is constantly racing to figure out how to fix whatever their problem is, or oversleeping, where they might, again, be engaged in escapism to constantly avoid whatever the trials of the day might be. Vague but chronic aches and pains. Usually we see that with muscle tension. People that have anxiety or over something, or maybe even suffer from depression, they are engaged, their sympathetic nervous system is constantly active. So they might be, they might have their shoulders up, and which creates neck tension, which contributes to headaches, right? So they may, somebody with depression might experience more headaches and aches and pains because their body is constantly on guard, right? And we talked about diminished sexual interests, loss in physical, mental energy, global feelings of anxiety, restlessness, and fidgety activity, which we have already explained. Okay. All right. So I'm going to play this video, and then we'll talk about it afterwards. Oops, actually, hold on one second. I don't think I engaged the sound on here, so let me share. No, I didn't. Okay.
At 15, he decided to have 3 stars. And that was, I think, an obsession for him. His obsession since 15 was the 3rd star. And when he got it, he wanted to keep it.
He got it 12 years ago, the story that made the front page of the New York Times, and has kept it ever since.
What was it like the day that you got the 3rd star?
We opened the champagne in the kitchen, and so it was something, for Bernard, it was something very special. And I must tell you that in the same week, we had our 2nd child, the little boy Bastien, and Bernard was unhappy because of this child, because it was on the wrong moment. You know what I mean? He said, why do we have this child this week? But I said, Bernard, 9 months ago, we couldn't know that.
So to have a son was an unwanted distraction?
A little bit, yes. Yes, I must tell you, that's the truth, yeah.
Au nom du Père et du Fils.
This was Bernard's final television appearance, his funeral earlier this year after he'd committed suicide. It was broadcast live on French TV. Thousands stopped what they were doing that day to watch and mourn. Many of them couldn't fathom why someone who appeared to love life would put a rifle in his mouth and take his life. He was 52 years old. Besides Dominique, Bernard left behind 3 young children. And he left behind a multi-million-dollar empire, 3 bistros in Paris, a line of gourmet frozen food, 6 cookbooks, and the pride of his life, his hotel and 3-star restaurant called La Côte d'Or. Go inside and you enter a magnificent manor house with beautifully manicured lawns and spectacular rooms. Located in the quaint village of Saulieu in the country's Burgundy region, La Côte d'Or is one of only 25 restaurants in France, culinary temples really, that Michelin has awarded 3 stars.
It's a shame to eat it, it's so pretty.
Those stars are the reason hundreds of food lovers each year make the pilgrimage here.
It just dissolves in the mouth, it's so tender.
For many of them, it's the meal of a lifetime.
It's just incredible. The taste is marvelous.
Bernard Loiseau liked to say that he was a merchant of happiness. What he meant, of course, was that he sold happiness to other people, the happiness that came along with one of his incomparable meals. But Loiseau himself was rarely happy. He suffered demons. And what he feared most was that Michelin would take away a star, that coveted 3rd star that meant the world to him.
I must tell you that 2 days before, I remember he came back in the evening. It was 11 p.m. He took off his veste de cuisinier and he said, "No, Dominique, I'm sure." I said, "You're sure about what?" And he said, "No, I know the press want to kill me." I said, "Bernard, please."
He believed the press wanted to kill him.
Yes, yes. But it was really not true. But it was like that in his mind.
A short time before Bernard committed suicide, Gomillot, a French restaurant guide less influential than Michelin, lowered La Côte d'Or's rating from 19 to 17. That hurt Bernard. About the same time, a story in the French newspaper Le Figaro said that Michelin too would soon take away a star. The story wasn't true. When the guide came out, Bernard still had his 3 stars. He knew that, but depressed, he killed himself anyway.
You never think at this point somebody is going to kill himself for this. Next course is the fillet of red mullet.
Hubert Couillou is the maître d' at La Côte d'Or. He'd worked for Bernard for more than 20 years and knew him well. And Hubert couldn't help noticing in the weeks before the suicide how depressed Bernard was.
So enjoyment. The last week he was so tired and so fed up everything, and he said he was just walking around in the kitchen and here, and he said, "I'm not good enough. I did what I could, but I'm not good enough. I'm not real good." I said, "No, don't say this. You're the most known chef in France, maybe, and one of the most known in the world." And day after day, maybe the last week was crazy time, crazy.
Okay. So yeah, I know this gets a little dark, unfortunately, but this is why we do what we do in this field here. So we already talked about what are the major symptoms of depression. What did we see in the chef? What kind of symptoms were there?
I would say feelings of worthlessness, certainly, with people who knew him saying that he, especially towards the end of his life, would talk about feeling like he was not good enough and things of that nature. So definitely being in a state of not thinking highly of oneself and not thinking highly of his own life. I think that would be one of the major symptoms. And I think as well, feeling as though that I suppose that his life and what he had dedicated his life to was kind of going off the direction that it had been, or that he was hoping that it was in.
Yeah, absolutely. I mean, he's definitely, through his talk, right? We could sense that. Now, looking at some of the other, let's see, go back here. Look at some of the other, like, were there any physical symptoms? Insomnia, these might be hard for us to answer. Actually, what I'd like you all to do right now is take a screenshot, if you can, because we're going to do a little bit of a group activity in this. Okay, so take a screenshot of this screen.
I have something to say.
Yep, go ahead, Zach.
It kind of looked like in one of the in the videos when he was smiling, it kind of looked like he had kind of like a mask on his face a little bit.
Okay, kind of like a forced smile.
Yeah, it looked like he was happy, but I don't know if he was truly happy.
Yeah,
I've experienced that before. So he was like, his goal was to give other people happiness. So
right.
guessing that he might have been. He looks happy, but he probably wasn't.
Yeah, and we see that a lot. We call that a fake smile, and it's usually when people smile, but they don't smile with their eyes. There's two different types of smiling: a smile that's obligatory, and one that somebody actually is happy and they can show happiness, and you can usually see it in their eyes.
I heard about this study. It's like I don't know if it was in communications or something like that in one of my classes, but we were doing like a fake smile thing. And a real smile, you can tell a real smile, and then you can tell what a fake smile is like, but it's very hard to see it. You just have to know what it is.
Okay, yeah, absolutely. And we'll talk about this when we get into this activity as well. So go ahead, take a screenshot of this as well. Major behavioral symptoms. Give me just a second here for that. And then take a screenshot of this one. And then lastly, take a screenshot of this one. Okay. Now, what I would like to do for this activity, I would like you to pick out one person that.
Sorry, do you
Yep.
think you could go back to physical symptoms, the last
Yep.
one?
Yep,
Okay.
sure thing. Yep. Physical, there we go. So what I'd like you to do is I'm going to break you off into groups of
All right, thank
3.
you.
Yep. And what I'd like you to do is pick one, either celebrity or somebody that that you knew that had completed suicide, or a celebrity or politician, or somebody famous that you all can relate to, or at least read up on, and try and answer these questions the best that you can, of these 4: the physical, the cognitive, the behavioral, and the emotional. See what you can dig up on that person as to what they showed, either to somebody that a loved one or family members or an audience or something like that, to see if there were any kind of patterns there. And if you don't have enough information, pick questions, just maybe a couple questions of what you would ask that person to see if you can gauge what kind of mindset they're in as far as suicidality. Okay, is everybody clear on what we're doing? So 2 things: try and answer these questions the best you can based on information that's available, and if it's not available, pick like maybe 2 or 3 questions that you could ask them to see if you can somehow indicate how they would indicate that they're feeling suicidal. Okay, does that make sense? Okay. All right. So let me break you off into, let's see, we'll do 3 rooms here. So some of you might have 4. Okay, give you maybe about 5-10 minutes tops. I'll check in with you 5 minutes to see where you are, and let me know who it is that you picked. Okay. All right. Rooms are open.
Is each person picking someone?
No, just one person per group.
Just group, okay.
Yep. All right. Give everybody a moment to come back here.
Hi.
Hi. Okay. Another 15 seconds. I think I might have closed a little too soon for room 3. They seem to be heavy in conversation. All right. So let's start off with group 1. That was Bridget's group. So who is the person that you picked, and what were some things in those categories that you found, and what sort of additional information would you have liked to have asked that person?
So we majorly talked about Kurt Cobain.
Mhm.
And I brought him up just because he's someone that came to mind that I knew some about. I talked a little bit about how I knew that he had struggled with substance abuse within relation to drugs and alcoholism and things of that nature. And I kind of related that back to in relation to symptoms, certainly going down those avenues of coping mechanisms that may not necessarily be the healthiest for dealing with the symptoms themselves is, I think, something that can happen a lot with people who are experiencing depression and whatnot. I also brought up how I had read about that I believe that he had bipolar disorder, and then also I believe ADHD as well. So like we were talking about with bipolar disorder being manic depression, certainly that, you know, could have definitely contributed to him getting into that state where he decided to end his life. And then with the symptoms, I had read a little about how people who were around him and leading up to the suicide said that he was very quiet and had seemingly had like trouble connecting with people around him and kind of like straying from those around him, and that relates back to kind of the isolation aspect of the symptomology. And so I guess further questions that could be asked was just, you know, exactly what he was experiencing emotionally, what, you know, exactly what exactly he was struggling with in his mind, to the point where he felt the only way to end his life was, or to alleviate his suffering was to end his life, and just, you know, kind of more intimate questions that you don't really have any answer to because, you know, we don't know him.
Right. Yeah. No, those are all important points. And yeah, I do remember hearing the news of Kurt Cobain. You know, as a Nirvana fan myself, you know, it was something that shook the, you know, and the people that knew him knew about his drug addiction, which is a pretty big indicator that somebody's trying to fill a void of some sort. So at a minimum, you know, we could say that there was definitely a mood disorder going on there. And unfortunately, he was not able to get the proper help in time to save his life. But yeah, I think you covered all the good points there. You know, there are some things that we just can't get into, especially if that person is so isolated that they don't want to let anybody in and let them know what they're thinking, which we'll talk about here in just a little bit. All right, how about group 2, Anne's group? What did who was the person? Good job, by the way, Bridget's group. I think you did an excellent job at picking a person and talking about the symptoms. Anne's group, what did you come up with?
We chose Robin Williams.
Okay. Yep.
Yeah.
And what did what were some symptoms there that were obvious, maybe to people that knew him? And what were some questions you maybe wanted to ask him?
His sitcom, I guess he had a sitcom show, and Joey found out that it was failing, and right before he committed suicide, I think he was doing a movie. It's called The World's Greatest Dad. I saw it recently, and it was very it was very strange. He was a father of a son who committed suicide, and he was, I guess, him as an actor was just kind of obsessed with how people reacted to his son's death. So I think it was just maybe he was a little he was just kind of I don't know, flirting, that's the wrong word, flirting with the idea of committing suicide.
Yeah.
But he had severe depression, and he also had substance abuse issues, cocaine and alcohol. He abused it. I mean, a lot, I guess, when his career took off. But he was a very well-known comedian too. So I think he was using comedy and humor as a way to like cope with his feelings and all that stuff. So
absolutely. And I think that's something that he had admitted to, is that that he used comedy to get by on some of the pain he was feeling. Yeah, he's one of my favorite actors as well. So what question or questions is it something that would help you to maybe understand where he was and maybe prevent in some way what he had done?
Joe, you want to go for this one, or Bridget?
Yeah, I'll go. So some questions I would have liked to ask him were like, yes, his sitcom and stuff were failing, but he had lived for 60 years, and he had been diagnosed with Parkinson's disease and stuff like that. And I would have liked to ask him, like, why don't you just want to live out the rest of your life? He had recently gotten divorced and then remarried a few years before as well. And I would have liked to ask him if he wanted to, like, just why didn't he just want to live out his life with his new wife? I would have liked to ask him, like, about the substances. It said that he had stopped using them a while before, but I would have liked to ask him if he was, like, secretly still using them. I'd like to ask him, like, pretty much, I just would like to ask him what's going on in his head. Like, let him just spill everything that his problems are, because I know with some of my friends, like, if they're feeling depressed or something, if they can just vent everything, that normally helps them a lot. So
Absolutely. And one of the things that I encourage upcoming counselors and therapists is to not avoid the question. In fact, ask directly, are you thinking about hurting yourself or hurting somebody else? And even if they don't answer, you can kind of tell. Remember that 80%, that body language and the tone of their voice, and you can usually tell if something's going on behind them that's not okay. So that's one of the things that I first start off with. If anybody comes to me and says that they're having a hard time dealing with something or wrapping their mind around something, I go right for the question, usually in the first session, and ask that person, are you thinking of hurting yourself or hurting somebody else, even if it's thoughts? And then I let them know that this is a safe space to talk about that. Because when we think about somebody admitting having suicidal thoughts, what do you think that person is most afraid of?
That you would kind of like call someone to come over wherever they're located to help them out.
Right. Yeah, they're worried about the proverbial, the cliche padded wagon where they come in, put the person in a net and throw them in the back and whisk them away off into an insane asylum somewhere, right? So that's one of the things that I let them know up front, is that having these thoughts are oftentimes very normal when somebody is experiencing extreme depression, and that having the thoughts aren't really a threat. It's not really an immediate danger. I mean, it's something that we want to decrease, but what we don't want is for it to go unchecked to the point where they're actually making plans and considering harming themselves for real, right? So again, that escapism in our mind is pretty normal when we are experiencing something that's so traumatic that we don't want to deal with it. So those thoughts alone they're okay. I mean, that's relatively normal. But where it crosses a line, if somebody starts planning and somebody starts committing to making that plan happen, that's where we don't want it to go. And that would be the point where they would probably, I would work with them to get to the hospital immediately, just to maybe check meds, check levels, get have a suicide inventory done on lethality, just to see how serious they are, and perhaps an inpatient stay for a period of time just for observation. Normally, as a therapist, I work with the person that tells me, if they tell me that they are walking out that door right now and they're going to make plans, I'll work with them to get them to safety by any means necessary. And if that doesn't happen, then I'm obligated by law to make sure that they do get to safety by any means necessary. So usually I've never had to institutionalize anybody. I mean, I've had to work with them to get them to the hospital, but I've never had to call the police or anything like that. So normally people that talk about that stuff are people that want the help and they're willing to go get it. So yeah, very important question to ask. I think your team covered that. Is suicide on your mind, right? All right, lastly, how about group 3? Who did you pick? That was Kristen, Lewis, and Zach.
Yeah, we also picked Robin Williams.
Okay.
Yeah, and we were pretty much saying the similar things, like he was living with Parkinson's, but after he died, he found out that it was a different disease. I think it was Louis' disease. I can't remember, but like the autopsy read differently. It was actually like he was suffering from multiple different diseases, and they found antidepressants in his system. So I guess like a question would be like, are the antidepressants like working? Are they effective enough? Do you still feel depressed? So he was obviously suffering with depression during his life, which is really sad.
Yeah.
Yeah.
Yeah, and unfortunately, a lot of what he presented to the world is probably what he presented to his doctors and therapists, is just putting on that happy face and pretending like nothing's going wrong, right?
Yeah.
Okay.
Yeah.
All right. Go ahead.
People were like, this is an unexpected thing. Like they were like, they didn't think any of that. It was like they didn't even know. Some of his very like close friends had no idea.
Yeah. I will, and I'll self-disclose a little bit on what my experience has been with suicide. Is I was in the military and worked in intel, and we're trained to hide secrets. We don't divulge certain things about our mission and certain things about ourselves and what we're doing. So what I found is there's really a relationship between people that are forced or expected to maintain those secrets, and they can't separate themselves emotionally from that. So unfortunately, I've experienced just in my lifetime, in my career, a high number of suicides of people, of coworkers and friends and brothers and sisters of mine, in the military sense, that have completed suicide. And I can say without a doubt that at least 98% of them, I would have never known. I would have never guessed. But that's part of what's wrapped up in that, is people hide behind whatever story, whatever they're good at presenting to the rest of the world. So anyway,
Constant struggle.
Yeah.
Because sometimes, with my bipolar, sometimes I do have those thoughts, but I have to work through them. And I don't have the willing to do it, but it comes there and it's there. And then you're like, okay, what's the choice you have to make? Are you going to do that, or what are you going to think about? And what I've learned is you have to think about the happy things. And I think about my family and how it would affect them and how everything would kind of happen and how they would feel. And I think I don't want to make my parents or my family feel sad about that. So
Yeah.
I think about the happy things, and I try to do other things to take my mind off of the bad things. And it's a constant struggle every day to do that, you know.